Welcome back. It is Wellness Wednesday. I am Dr. Long from Long Health and Wellness, and today we're going to talk about a trending topic. Irv Gotti, the music producer, recently passed away of a stroke due to complications of diabetes. And so today we're going to talk about how diabetes could cause a stroke and what you can do to prevent it. So, people often think of diabetes as just being elevated blood sugar and your pancreas or your endocrine system not really giving you enough insulin to control your blood sugar. But those elevated blood sugars actually do damage to your blood vessels and your nerves. So, over time, if it's uncontrolled, then your blood vessels get more narrow, and that is where the increased risk of stroke comes from. And so, not just a stroke, it's actually stroke, kidney damage, blindness, heart attacks. So anything that involves blood vessels, it usually starts with smaller blood vessels. So one of the things that uncontrolled diabetes will do will narrow the blood vessel in your eyes, and that can cause something called retinopathy. It narrows other places that need blood flow. So it's a cause of erectile dysfunction. Diabetes is the most common cause of blindness in the United States, I think. Also, the most common cause of people winding up on dialysis, contributes to heart attacks, strokes, neuropathy, which is when your nerves are damaged. It starts at the smallest nerves, similar to how it starts at the smallest blood vessels. So the smallest nerves are going to be the ones furthest away, so your fingers and toes, and then it works its way up to the central part of your body, which is why you see people with foot and leg amputations when they have diabetes for a long time that's not well controlled, because those vessels get damaged, the blood flow decreases, the feeling in your nerves decrease, and then next thing you know, you have these wounds that can't be treated, and boom, amputation. So we definitely want to encourage you to control diabetes. So things that you can do to prevent this from happening to you is, one, make sure you're making healthy food choices. So part of the reason diabetes is so prevalent is because some people live in food deserts. You have lack of grocery stores in certain communities, or just unaffordable healthy foods. You have poor access to healthcare, so people don't go to the doctor until they're almost dying. You also have poor understanding of these conditions, so people don't even think about the need to get screened. So one, we want you to try and make healthier food choices. So instead of drinking sodas or sweetened beverages, stick to mostly water. You can add fruit to your water if you want to have a little flavor. Instead of eating sweets or crackers as snacks, try and eat fruits or vegetable snacks. Try and stick to unprocessed foods as much as possible, because we don't really know what those chemicals that they add to the foods are doing to your body. You also want to make sure that you are getting some regular exercise. People who exercise have been shown and proven to be less likely to develop diabetes. And even if you have diabetes, exercise can help control it. And the third thing you want to do is visit the doctor at least once a year, especially if you have any type of family history of diabetes. You want to get your numbers checked. So you want to get your fasting glucose checked. Fasting glucose is a minimum, but the better test would be to get your A1C checked, and your A1C measures your blood sugar as a percentage over the course of 3 months. So fasting glucose will only tell you what your blood sugar is in that minute, but the A1C will tell you the average over 3 months. So it's a little more accurate in terms of looking at a long-term picture. So I usually check that on my patients at least once a year. For people who are high risk or people who are in that pre-diabetes range, I would check it at least twice a year. And just make sure you stay on top of those types of things so that you are able to step up your preventative steps if you are at increased risk. So those are the things that I am going to encourage everybody to do. Talk to your friends and family about getting checked, and then make sure you are staying up on your preventive wellness steps. Let me know in the comments what you're doing to maintain your health, prevent chronic diseases, and then don't forget to like, share, and subscribe if you would like to continue seeing Wellness Wednesday. I'm Dr. Long. I'll see you next week.